it surprises us. And then the implications of that, which Krista may talk about, is can be really devastating. So we want to learn all we can to keep ourselves vertical and keep moving forward and living a long and healthy and unimpaired life. So many of you know Krista. I think she's probably seen many of us in therapy at various times. And I did tell her that a Sunday or so ago when I announced it, and I announced who was presenting, I heard this, oh. So, not her. She gonna make us work.
Oh, yeah. Well, we could get there if you want, but hi, this is a good crowd. I like this. And like I said, some familiar faces. I love that. Some unfamiliar faces, so new friends to meet and get to know. I'm not used to a mic, so bear with me if I start sagging. Tell me, is it Crystal? Lift your hand up. This is Amanda Stargart. She is a physical therapy doctoral student who is doing her clinical rotation with me right now, so she got dragged along. So there you go.
Happy to be here.
Yeah. I was also super excited that when I saw the little flyer that Trish made up, she gave me hair. Did you notice that? I was so excited. I'm like, oh, long brown hair. I was very excited. So anyway, I will try not to wander in front of the screen. Let me get this out of the way. So yeah, so we're talking about fall prevention, which is the very exciting topic for all of us, right? So I think one of the things I think you're going to learn the most today and be most impressed with is that it is such a complex subject. You know, we think, okay, well, if I don't want to fall, I just got to work my balance. You know, that they think, well, my balance isn't strong enough anymore. It is so much bigger and broader than that. And that's kind of the impression that I want to make today, is that it's a very complex subject and there's a lot to talk about. So with that being said, I'm really going to skim the surface because I only have, she told me I have like an hour and a half-ish or so. I just have to leave by 3:30 to go see a patient, so I can hang out for a couple hours at least. But I'm going to have to skim the surface because it's so complex. There's so much to go over. I actually teach a 6-week class on this, and we're starting a new cohort. So I will tell you at the end how, if you want to dive deeper into these topics, then you come to my RISE class, and we'll talk more about that at the end, okay? So where's my clicker? Right here. Got to think about how I'm doing this. Okay, so if we're going to talk about fall prevention, we need to define what a fall is, right? So the definition of a fall is an incident in which a person suddenly and involuntarily comes to rest on the ground or other lower surface with or without loss of consciousness. So the key words there are that it is sudden. Now, it doesn't have to be fast. It's just sudden, right? Because you can be leaning down and kind of in slow motion and kind of go bum over tea kettle, right? But it's sudden, that you weren't planning it. And that's kind of the biggest thing, is it's uncontrolled and it's unintentional. You did not intend to be on the floor, right? It's downward placement of the body. So a fall isn't necessarily always to the floor, right? So if I'm standing up from the side of my bed and I lose my balance and plop down on the bed, it was sudden, it was uncontrolled, it was unintentional. That technically, by definition, is a fall. Okay. Now, thankfully, it's easier to get up from the bed than from the floor. And you might not have gotten injured because it's nice, soft, and cushy. But by definition, that's still a fall. It was unintended. You went from a higher surface to a lower surface. If you lose consciousness, that's also considered a fall. Some people say, well, I didn't fall, I fainted. Well, you did both, right? So that's the definition of it. Here's the bad news. Everyone sees the statistics. We don't need to linger on this too much because statistics are going to change very quickly. Basically, the one that stays the same is about 1 out of every 4 older adults will have a fall. Older adults, 65 years and older, in each year span. The other thing that was interesting, I put this on here, is this is an old statistic. It's 2015. It's 11 years. Do the math. It's 11 years old. But back in 2015, the total medical costs of the falls was $50 billion. Think about how much that would be now, 11 years later. And that's why I kept this old statistic on here. Between inflation and medical costs and everything like that, you can imagine that that's a lot more now. So let's not linger on that slide. Because the good news is, we can do something about it. I wouldn't be here talking to you if there was no hope. If there was nothing we could do about it, that'd be silly for me to sit up here and talk for an hour and a half. But there's things we can do. And like I said in the beginning, it's so complex, and there's so many different aspects to this that we have many different angles that we can work out to get things better. Right? So balance itself, it's a skill that can be improved no matter what age you are. Strength is a thing that can be improved no matter what age you are. There are many things you can do to decrease your fall risk. So that's the good news. So I like this slide better than the previous one. Right. So if we're going to talk about falling, we got to talk about how do we even maintain our balance, right? So let's talk about how your body actually maintains your balance. So I'm standing here upright, and there's different types of balance. I have to hold my balance standing here statically, not moving. But I also need to hold my balance when I'm walking. So it's more dynamic. But there are 4 systems in your body. Ooh, if I get this really close, it gets real loud. So tell me if I'm too loud or too soft. There are 4 systems in your body that have to work together very quickly and constantly to maintain your balance. Okay? First one's the brain. That's a no-brainer, right? Your brain kind of does everything. It sifts all the information coming in from your body. Your brain has to coordinate things. There are also very specific parts to your brain that are meant for your balance. Your brain stem, we've got this glob back here that's called the cerebellum, and that is a part that's very specific to coordination and balance. Cats, cats are very agile, and they always land on their feet, and they have such good balance. You see them walking on railings that are this thick. Their cerebellums are much larger in comparison to the rest of their brains, and that's why they have such exquisite balance. The other part are your eyes, right? So my eyes are telling my brain that I'm upright and I'm looking horizontally. So my eyes are giving my brain all that feedback of, oh, she's starting to tilt. She better come back up, right? My eyes are telling my body where I am in space. There's a party trick with babies. You have to wait till they have head control. Don't do this if they don't have head control. It'd be really rude. But if you take a baby and hold them and just tilt them, they'll go, because your brain wants your eyes to be on the horizon. So if you tilt the baby, they're going to go. Because your brain does not want you to see looking the world like this. It's going to say, no, you're falling, you're moving, you need to come back on the horizon. Okay. Inner ear. You kind of all have heard that too, right? You've got some balance in your inner ear. There's a vestibular organ in your inner ear that's different from hearing. So they can be a little bit combined, but it's different from your hearing part of your ear. This part does several different things. Basically, if I have my eyes shut, so my eyes are not telling my brain anything, my inner ear is going to tell my brain when I move my head. I just move my head to the right. I just move my head to the left. I'm looking up. I'm looking down. So you have checks and balances. My eyes would tell my brain that too, but if I have my eyes shut, my inner ear is going to tell my brain that. Okay? It also tells my brain if I'm moving up or down, like in an elevator. So if you're not in a glass elevator and don't see yourself moving, you sense it, right? You can sense that you're kind of moving up in an elevator. You can sense that you're moving down. Or if you're moving forward or back in a car. That's the other part, that inner ear. Okay. And then that fourth person system in your body is somatosensory system. That's a big word. What that is you've got sensors in your hips, knees, and ankles, in your joints, that tell your brain that you're staying upright. So If I have my eyes shut, my eyes aren't saying anything to my brain. I'm not moving my head, so my ears aren't saying anything to my brain. But if I'm leaning back, my ankles, hips, and knees are telling my brain she's going backwards, she better catch herself. So if you have your eyes shut, you can tell I'm leaning forward. I better catch myself. So you have these sensors in your joints that'll help tell your brain where you are in space. Yeah, yes, and by all means, ask questions as we go. I meant to say that earlier. Oh, good thought, right? Very good question. And yes, that system is altered for that particular joint. You're still going to have it in your other joints, and that's what we train in physical therapy. That's why physical therapy is so important after a joint replacement, is that we will then help retrain your balance systems to work for you after that total joint replacement. Exactly. Yes, but no. I'm gonna be vague on that answer. Any system, anything that's going to address any of these systems, and that was kind of basically the next thing, anything that affects any of these 4 systems are going to impair your balance also. Yeah. Yep, you guys are jumping ahead of me. Yes, no, you're good. No, you're good. We're going to get there. Yeah, because you're exactly right, because it affects your eyes. So anything that's going to affect any of these 4 systems are going to affect your balance. Now, these 4 systems work very quickly together. As we know, when you kind of lose ability in one area, other areas of your body can kind of take up the slack, right? Blind people get more acute hearing, things like that. So as we age, or we have different medical conditions, or we have different injuries or whatever, if one of these 4 get a little impaired, the other 3 are going to pick up the slack. And so that we can kind of keep that, no pun intended, we can keep that balance of the systems, okay? So now that we know how we maintain our balance, now what happens that creates falls? There's kind of 2 big camps to that, intrinsic and extrinsic. Intrinsic meaning things that are inside of me, inside of my body. Extrinsic are things in my environment. Right? So intrinsic, first thing you got to think about is just all our natural aging process, right? The fact of life, right? As we age, we start losing some of our vision changes, our sensory changes, and things like that. So vision changes doesn't even need to be something like macular degeneration, but we just know with cataracts, glaucoma, just we start losing a little bit more of our vision as we get older, bifocals. That's kind of more of an extrinsic thing, but when you first got bifocals and you're trying to go downstairs for the first time, oh my God, you're like, where's that step, right? Sensory changes, our feet might start losing a little bit of their sensation, getting a little bit numb in your feet, fingertips, things like that. If you can't feel your feet, that's what you're literally standing on. That's going to decrease your balance if you're not feeling where your foot is. These last 4 are kind of changes in your musculoskeletal system. You've got your decreased flexibility and range of motion of your joints. You can't quite move your hips or knees as far as you used to be able to. Your ankles are a big one, because if I can't move my ankles as much, I can't really react and catch my balance. Decreased strength in your legs. This is kind of the classic things that people kind of think about when they think about fall prevention of strength. And yes, it is a huge part of it, but it's really more of a matter of being able to catch your balance once you lose it. So, like I was talking about, you've got this static balance. Those 4 systems have to maintain my balance here. But if I lose my balance, even if I'm standing still and I lose my balance, I'm down at Fall Fest, which I never do, but if I am down in Fall Fest and you get knocked over by the crowds over there, you get knocked over, I've got to be able to react very quickly. And if I don't have the strength, the reaction time, and the range of motion in my ankles, feet, hips, knees, to be able to catch myself very quickly, then you end up falling more, right? So the other thing was then there's the dynamic. When you're walking, there's trips and slips. I'm walking and I trip over something. I've got to very quickly get both my feet off the floor, right? If I'm tripping, I've got to very quickly catch myself. And that's where this stuff comes into play, right? So the other intrinsic factors are medical conditions. Again, looking back at those 4 systems, anything that affects your brain, your eyes, your ears, or your lower extremities are going to affect your balance. So we talked hydration is a big one. We talked about hydration and nutrition are very important, especially as we age. It's harder to stay hydrated. If we're dehydrated, we're not having healthy tissues, but we also drop our blood pressure. So we didn't talk about the medical conditions now are kind of whatever affects those 4 systems, like the brain needs blood. If your blood pressure drops and you faint, you're falling. If you're not hydrated, you're more prone to fainting, right? Because your blood pressure's down. You need blood volume to keep your blood pressure up. Peripheral neuropathy. We all get to know that term as we age, right? There's a lot of conditions that can cause it. Diabetes can cause peripheral neuropathy, but that's when your nerves in your lower legs and your hands are not working quite as well, so you're losing your sensation. Sometimes it even hurts. So if I'm losing my sensation, don't feel my feet, or if they're burning or hurt, it's certainly going to be harder to maintain your balance. We talked about fainting. Vertigo. It's one of my favorites. That's one of my areas of expertise. Has anyone in here seen me for vertigo? What is vertigo? You don't get to answer because I probably told you the answer. What's vertigo? Good answer. Yeah. It's right. Hitchcock film. Yeah. So remember we're talking about those 4 systems, the brain, the eyes, the ears, the legs. Vertigo is just the medical term for dizziness. It's not a diagnosis. And that's where people kind of go wrong. People think it's a diagnosis, and including healthcare professionals, doctors and nurses, and so will say, you've got vertigo. Yeah, you've got dizziness, but they're saying it like a diagnosis. It's like, you've got pain. Well, yeah, I've got pain, but that's not the diagnosis, right? Where the most common thought of that is, have you heard about crystals? Yeah. They kind of those terms get used synonymously. People call, when you've got crystals, they call you vertigo. Well, the crystals aren't vertigo. The crystals are causing vertigo. It's causing dizziness. Vertigo is just the medical term for being dizzy. So crystals, real quickly, it's when I was talking about those inner ear, you've got little canals in there with fluid, and debris gets in those canals that aren't supposed to be there. It's a very structural issue. It's easily treated. It's very common, unfortunately, the older we get. It's very common if you've got diabetes, osteoporosis, vitamin D deficiencies, things like that. But certainly if you're spinning, and typically with the crystal kind of dizziness, it feels like the spins. There's so many different definitions of dizziness, right? Because I can be dizzy and feel faint. I can be dizzy and feel like I'm spinning. I can be dizzy and feel like I'm on a boat. So it's a wide variety of what dizziness means to people. But nonetheless, all the dizziness will help increase your fall risk. If you're dizzy, it's hard to stay on your feet sometimes. We were talking about how the 4 systems will kind of compensate for each other. I was just thinking about being on a boat. If you get seasick, what do they tell you to do? Exactly. So what you're doing is, being seasick is your inner ear screaming. And it's saying, oh, but I don't like this, because you're waving. Blah. And so what you do, if you're using your vision to override that, if you can look on the horizon, you're using your vision to kind of calm down your inner ear. Yeah, so you can use those 4 advantageously to kind of help each other out. Pain. Yeah, when you're in pain, it just hurts to walk sometimes, especially if it's a hip, knee, or ankle, and you're limping. That certainly can cause a fall issue. Vision impairment kind of goes back to what we were talking about before. Any vision impairment, macular degeneration, cataracts, glaucoma, all that stuff. Remember back in the pandemic when we were wearing masks? We found a lot more people were falling wearing the mask. Just put your hand up like it was a mask. All of a sudden, you've lost vision of your lap and the floor, right? So we were wearing masks and taking away our vision field of the floor. So people were tripping on stuff and stairs were hazardous, right? Because we took away that part of their vision. Inner ear infections. You all know, you've all had colds and felt, ugh, kind of dizzy, right? Any ear infections, you get viruses in your inner ear. Incontinence. There's a couple different reasons why that's on there. First of all, if you're incontinent, a lot of times you're rushing, right? You're rushing to the bathroom and rushing and going faster than what you really normally do and have safety on your feet. Sometimes that can cause a fall. But also, some of the medications, and we'll get to the medications, but some of the medications can actually, that you're on for incontinency. And we'll get that to at the pharmacy time. Osteoporosis, that's really on there more because of that kind of goes along with weakness in general. But when you fall, if you have osteoporosis, you're certainly more prone to an injury. Is that right? Et cetera, et cetera, et cetera. I mean, I could talk a million hours just on medical conditions that are going to affect balance. But these are just a smattering of kind of going of what any stuff that I didn't even really go into the brain stuff. Think of all the brain stuff. Strokes, dementia. Dementia does affect balance, affects your brain. All that, anything. So the other big intrinsic factor is medications. How many times have you read the inserts and it doesn't say that it's going to make you dizzy? Every single medication seems to make you dizzy. At least the potential, right, when you read the inserts. And what part of that is that when you put a medication in your system, it's in your entire system. So it's affecting your brain. And that's going back again to one of the four people, I call them people, my characters, that have to work to keep your balance. But there are specific medications that are notorious for affecting balance. Narcotics, the big one. And if you put and usually we're using narcotics mostly after surgeries. So then got a 2-for-1, right? You've got pain, you're being medicated with narcotics, your mobility is being restricted because of whatever surgery you had. Sleep aids, that makes sense, right? The whole point is to put you to sleep, make you lethargic. But how many of us have to get up in the middle of the night to go to the bathroom? Right? So you've been medicated to sleep, but now you got to get up and go to the bathroom, and you're unsteady on your feet. Then you add in the fact that your lights are out, so you're taking away some of the vision, right? So it's kind of a perfect storm. And we'll talk about strategies to help not have that be a perfect storm, so you're not on the floor. Antidepressives, anti-anxiety medications, because they affect the brain. It will increase fall risk. Blood pressure medications, because we talked about that. If you have low blood pressure, it's going to increase your risk of falling. If you're being medicated for high blood pressure, but your dosage isn't quite dialed in yet, and you're working with a doctor on getting the right dosage, it might be taking your blood pressure down the opposite way. It might be taking it too low. Or you might have just had surgery. And so after surgery, sometimes your blood pressure medication dosages need to be adjusted so it's not taking your blood pressure too low. So that's why you gotta work really closely with your doctor in monitoring your heart. If you're on high blood pressure medications, please, please, please be checking your blood pressures at home. Particularly if you're having procedures, surgeries, things like that, because you might be over-medicated a little bit after surgeries, and check with your doctor. Okay? I see that a lot. Any medication that affects the brain. So that goes back to the incontinency. So Flomax, people on Flomax, they're called anticholinergics. They will also affect your balance. Now, so the point being, I'm not saying not to take your meds. You need to take your medications, but you want to be in good, consistent conversations with your primary care providers or whoever is prescribing the medication of dosages, reactions you're having. If you're having that dizziness side effect, let them know, because there's many different medications you can take for one thing, right? So they could try a different medication that you might not feel dizzy on, right? So what can you do to make any change in these intrinsic factors that we were just talking about? The biggest thing you can do, absolutely, for everything that we just talked about is health and wellness. The bottom line is just stay as healthy as you possibly can. So just a brief kind of commercial on health and wellness. We got the big pillars of health and wellness. What things do you need to attend to maximize your health and wellness? Right? Nutrition, exercise, sleep, stress management, managing your medical conditions, and managing your mental health, right? Nutrition, we talked about the importance of hydration. As we age, we need more protein. That's the one macronutrient that our body needs more of as we age, because your muscles need protein. As we age, we lose our muscle mass just by aging. And so we need more protein to maintain our muscle mass and our strength, in addition to exercise. And I bolded exercise because I'm a PT and I made the PowerPoint. And I can bold anything I want to bold. And to me, that's the most important thing, right? The sad reality of this body that we live in is if we don't use it, we will lose it. If we don't use the abilities of our body, we will lose the ability to use our body. And as we age, the natural tendency is to be more sedentary. We're not quite as active as we were when we were in our 20s and 30s, right? So things get a little bit harder. Getting out of that soft couch is a little bit of an ugh, and it becomes more and more of an ugh. If you're having difficulty getting out of a soft couch, it's hard, sometimes it's hard getting off the toilet. You know, you need to push up with your arms a little more. We lose our muscle mass and strength as we age, unless we do something to not lose it, which is exercise, right? We can always maintain our strength with exercise no matter how old you are. They did this great study where they took 80s and 90-year-olds that typically did not exercise. They put them on an exercise program with strength training for 6 weeks and showed significant improvement in their muscle strength. 90-year-olds. So you are never too old to get stronger, ever, which is the nice thing about this body, right? We can always mitigate that. Yeah, Trish?
I was going to add a comment because I was in the class with spoke at, so many people say, well, I'm so active. And Krista said, you need to specifically exercise so you can lose weight.
Exactly. Well, thank you for segueing into my next comment, because being active is fabulous, but to maintain your strength, you really need to do strength training, which means you need to lift heavy things. You need to move your heavy thing might be your body weight, but you need to lift heavy things to become strong. Walking is fabulous, but walking is not a strengthening exercise. So, we have tons of these races every single weekend. And I try to keep track of them just so I know where not to drive that weekend. But we've got the bike races and the tries and the whoosy-whatsies, the running races, and everything. So, these athletes, they're not just going to the race, right? They've trained for that race. They've exercised specifically for what their activity is. Biking, running, swimming, whatever. So if you think about it, we might not be athletes. We might not be a triathlete going out to go biking. But life is a sport, right? Our life is a sport, and we all have our own individual sports that we like to do in life. One person might want to, it's very important to them that they're getting down on the floor and they're playing with their grandkids. Or it is important to me that I like walking and hiking, but I also want to be out in the woods, which is very different walking than on down the sidewalk. Or I had a patient who, the most important thing to her, she was a very devout Catholic. It was very important for her that she could still kneel in church. So if you can identify those activities and issues in your life that are important to you, what is important? It might not be important to the next person next to you, but what's important to you that you can still maintain? What skill, what activity, what hobby, what is that? Then you need to make sure that you're training and doing what you need to maintain that ability, right? Something to think about. Yeah.
Go back to nutrition again.
Yeah, yeah.
My experience, I've been eating it. And my experience is I have a really good breakfast with egg and avocado and toast every morning. However, something made me change it to the point where I started making myself a smash burger for breakfast every morning. And I could not believe the results. What that did for me.
Results in what way?
My energy.
Oh, yeah.
In my energy. Of course, I also dropped my Paxil too. I'm not doing that anymore.
Well, I don't suggest that
No,
without
I
talking
know,
to your
I know.
doctor.
I know, I can't, when I get back home
Yeah.
at the end of the summer, maybe I'll make it.
Yeah, you should mention that.
That's right.
Yeah, that's an important one to mention.
Yeah, but I did want to emphasize that hamburger, the smash burger.
Yeah. Now, point being is, we all are protein, but we all are also very different in our nutritional needs, and that's when you should work with a professional, with a nutritionist, because we all have different issues with our bodies nutritionally, just like we do with medical conditions. And so we need to make sure that you're getting the right nutrition for your personal issues also, right? But yeah, you made a change and noticed a huge difference, which was great. Yeah. Sleep. Remember, we used to say, "Oh, I'll sleep when I'm dead. I'm busy." And we used to say how proud we were that I only have to sleep 4 hours a night. And we thought we're all smart about it. But now we're realizing, oh, we were really not smart about that. Your body absolutely 100% needs sleep. It is vitally important, no pun intended. That's when your body restores. That's when your brain literally gets cleaned out. You have this circulatory system called lymphatic system. I can't pronounce words sometimes. That's where it helps wash and clean out your brain at night. It's vitally important. So give yourself a good 7 to 9 hours in bed so that you're actually asleep for that time, right? That's a whole topic in itself. Stress management. Stress management is both physical and mental. We think of stress management as mental, right? Keeping my emotional stress down. In working with mental health also, depression, anxiety, but working with the mental health professionals to decrease that emotional stress. But think about physical stress. Pollutants, plastics, wildfire smoke from Canada, right? Those are all going to be affecting your health and wellness. Absolutely. So things to think about. Health, that's the biggest thing you can do, is look at your general health and wellness. That's going to help you decrease your fall risk. Let me jump back to exercise real quick, just because I could talk for hours on exercise. How many people watch their step count each day? Yeah, now that we've got smart watches and all that kind of good stuff. What were you told? How many steps were you supposed to get each day? Have you heard? Yeah. Do you know where that came from? Do you?
Yeah, some Japanese fellow with a radio just threw that
No, you're absolutely right. It actually was Japanese was the person who first made the pedometers that people used to wear. And it was him. He had developed it and gotten the patent. And so he was being interviewed, and the guy said, "Well, how many steps are you supposed to get a day?" And he's like, 10,000. Because it was just a nice round number. 10,000 is a nice round number. But the nice thing now is that it's becoming so popular. There's actually good research on it, and the research. This great study came out just last year, actually, that said if you hit 7,000, that's the sweet spot. So it's even better. It's like, whoo, 7,000 is a lot more attainable than 10,000. But if you hit 7,000 steps a day, it decreases all-cause mortality by 50%, by half. 50%, 50. All-cause mortality. What does that mean? All-cause mortality is the medical term for anything and everything that's going to kill you. Literally. Anything and everything that's going to kill you is decreased by 50% if you're averaging 7,000 steps a day. And that goes back to why I have exercise bolded. If you're walking and active, you're much more healthy. The more sedentary you get, the more problems we have. I'm talking very sternly. My mom, some of you know my mom. I'm my mom's caregiver. And she says, "Krista, sometimes you talk so sternly." So I just noticed that. So tell me to, Krista, you're talking sternly. Stop. So we're still back at the intrinsic. What can you do to change the intrinsic fall risk stuff? Basically, everything we talked about has a medical professional. Talk with them. Learn from these people, right? Your physician. Have them, first of all, early treatment, early prevention, early finding of your medical conditions. Get them treated. Talk to your physician about your medicines. Doctors are very quick to prescribe medicines for good reason, but they're not necessarily good at taking you off of them unless you kind of remind them, right? So when you're going in, say, let's review my medicines. Do I still need this one? Do I still need this dosage? Maybe you still need it, but maybe a lesser dosage would be okay. Physical therapist. I should have bolded that. Dang. Physical therapist is the most important person on there. We're the professional. Our area of expertise is mobility. That's our area, mobility. So we can assess this whole system on how it's moving and grooving in the world. So everybody's balance can be different. One person might have a difficulty with their brain part. Another person might have difficulty with their inner ear part. We can figure out which one of those four systems are having difficulty and the strength and coordination and reaction time of your legs, and we can make a person-specific tailored treatment plan to what your issues are. So if you're feeling that you have difficulty with your balance, come to physical therapy. Now, in the state of Wisconsin, we don't need to have a referral to see you. However, we have this wonderful thing called insurance. And so most insurances want a referral to pay. So just to be safe, unless you really find out whether insurance will let you come without a referral, our docs, we work so closely, especially Sister Bay. We work so closely with the providers downstairs that if you even just write them a note through the portal and say, "Can I have a physical therapy referral?" they just send it up. They're not. We work very closely with them. They won't make you go see them first usually. If they're concerned about something, they might want to see you first. But ask for a PT referral. We can look at that. Occupational therapists look at home safety, home setup, grab bars, how to get things set up so that they can decrease fall risk. Podiatrist, we were talking about those foot issues that cause issues, right? With your balance, you're standing on your feet. That literally is the point of contact to the ground. So anything that affects your feet. Now, we talked about the peripheral neuropathy, but what about hammer toes, bunions, all that kind of stuff is going to affect. Optometrist or ophthalmologist, I should have put both, right? Go see your eye doctor. vision problems, clear up your vision so you can have your sight to help. As we age, we become very vision dependent. Those 4 systems we were talking about, your vision probably stays the strongest, and we like to have our eyes open, be able to see things, right? So how many of us have gotten to the point where we're in the shower, we close our eyes to not get soap in our eyes, and we go, woo! You know, or you're touching the side of the shower while you do your hair because you have your eyes shut. We like our eyes. So think about lighting, especially when we're getting up in the middle of the night. I see so many people that fall getting up to go in the middle of the night for many reasons. The nice thing is we get more and more technology. So we don't necessarily have to have night lights on because people also want to have darkness to sleep. But they have sensor lights now that you can put along the baseboard, and it'll light up as you walk. And then it times out after a while. So think about having things lit up. I have treated more than one person who has fallen because they tripped over a dog toy. I know, or dog, exactly. Exactly. I've also treated another person who tripped over their granddaughter's toy. You know, when you have kids visiting. That goes kind of back to home setup and safety, making sure, you know, the clutter, the things that are in the way. Throw rugs. We all love our throw rugs. You know, it covers up that stain from 1972. But also the high traffic areas, you know. We love our throw rugs, but the reality is you catch the edge of it, they wrinkle up a little bit, so it's not even catching the edge, but there's a little wrinkle in the middle, and you trip on it. Things to think about. The pharmacist. So you talk with the physician about whether you need the medication and the dosage, but the pharmacist is going to help you know interactions of all of medications, because you might have more than one doctor giving you meds, right? We all know that we've got your primary care, you've got your cardiologist maybe, you've got your eye doctor who's getting you eye drops and stuff. The pharmacist can look at the bigger picture and kind of see, well, you know what, these 2 medications are probably going to be making you dizzy. They'll kind of look at that with you. Dietitian for nutrition, hydration. Yeah, so there's always someone to learn from. And if you know that your specific issue is maybe I'm having difficulty with nutrition, well, ask the doctor. We have nutritionists and dietitians at Door County Medical Center. Ask your primary care physician to get you a referral to the dietitian. Or whatever, if you're having problems with vision, see the optometrist. So those are the things you can do about all those things that are inside of you. Yeah. Audiologist? Well, you could, yes. There actually is proven that if you've got decreased hearing, that does affect your fall. It's not as much as these, but yes, absolutely. If you're having any, that kind of goes back to medical issues. If you're having hearing loss. Now, are you thinking more about the vestibular part of your ear or your hearing? Yeah. Yeah, because vestibular wouldn't be the audiologist. It actually would be physical therapist for the vestibular part. And most of you Northern Door, I would assume, and Sister Bay. So at Sister Bay, we have 2 of us that specialize in vestibular. And that's me and Jen Gaddis. Everyone knows Jen Gaddis, too. Yeah. Vestibular, that's that inner ear and your brain together. Yeah. When you're dizzy or losing balance, yeah. Yeah.
Getting back to medication, overly medication.
Mm-hmm.
The reason I dropped my Paxil for anxiety is when I was only taking 15 milligrams. That's pretty low. I thought I just dropped it cold, which is recommended not to. But what I got back out of that is I can cry again. I'll tell you, I haven't cried in years. And now I am able to again. Music affects me. Some picture of a dog doing something. I mean, I'm not overly kind, it's just that I'm not used to it, and I love it.
Well, that's certainly understandable.
Yeah.
Again, like you mentioned, it can be very harmful to go off of a medicine cold turkey. So I hope, if you want to go off, again, talk to your doctor about going off medications and how to do that appropriately. Because you might very well be appropriate to be taken off medication. That's good. Like we're talking about, we want to decrease how much medications are in your system, but make sure that you're not causing other issues. And I'm not saying you are,
No.
but
And when my dad was put on Prozac, he told my mother, even if he died, I would.
oh goodness,
I know, that's pretty good for him.
yeah,
That was the bad side of it, I think.
yeah. We've been going for about 50 minutes, 45 minutes. Do people need a 5-minute break to go potty, stand up and shake your booty a little bit? Anything?
Yeah.
Yes. Okay. Let's just take it. Yeah, let's take a 5-minute break. That's fine. Let's take a 5-minute break, okay? All right, guys, you want to kind of meander back in and we'll get settled again? How do we get a UU not to talk? The chime. Oh, right. The chimes. I'm like, bang on the chimes. All right, you guys. Why don't we kind of continue on in the journey here? All right. Woo! I timed out. That wasn't very hot. There we go. Now we're back. All right. So we just finished up talking about all the intrinsic parts. Remember, there's two things that really affect our balance, intrinsic and extrinsic. So we got through intrinsic. Let's look at extrinsic. These are things that are outside of my body that are going to affect my balance. We live in Northeast Wisconsin. The summer is wonderful. And the winter is great. But what's the biggest thing that we have in Door County? Yep. Biggest thing for us is ice. So we kind of have a little game at work of the first therapist that gets the first person of the year that fell on the ice and is now in PT. And then it just goes all winter. We see a lot of injuries from ice. That's a big one here. And we'll talk about what we can do about it in a minute, but let's get through some of the other. But there are other extrinsic things. And that's what we kind of talked a little bit about already in the house, right? Low lighting, we've talked about that. Trip hazards, we talked about that. Slippery surfaces, not ice, but slippery surfaces at home. Water drips, you're at your kitchen sink and water drips on the floor. Getting out of the bathroom, tub shower. Ooh. You step out, woo. Grab bars. Making sure you've got good things. And not just a towel on the floor. I've treated patients that, I put a towel on the floor to pick up the water. Well, yeah, it became a surfboard, right? Yeah. Like I said, some people know my mother. She's up here now. I'm her caregiver. I was just out of PT school, so it was early 90s, maybe 89. I graduated in 89, so it was around there sometime. just graduated from PT school. I thought I knew everything, and I didn't know anything. But she was working as an alcohol and drug rehab counselor, was her career. She was phenomenally good at it, too. And she was working in inpatient and detox unit. And she was standing at the nurse's station counter, and she was documenting a chart. They were mopping the floor behind her. She turned to walk away. Both feet went up in the air. Her head landed on the counter and then landed on the tile. And my mother has a head injury from that. So, you know, thankfully, most places are good. If you're in public spaces, they put out those little yellow pylons, wet floor. But just be extra cautious, right? It's not just ice. It's any kind of wet surface, slippery surface. The other thing, too, is with the heat, we've been having these really crazy high heat days, which we never really had in Door County before. But now we're having these high heat days. And if you don't have air conditioning, because a lot of people don't, I don't in Door County, the condensation and the humidity can make tile floors very slippery. So things to think about, too. Uneven surfaces. I'm a birder. I love to look at birds. But they're up here, and the tree roots are down there. So I walk along, and I'm constantly tripping on tree roots. So uneven surfaces. We don't have cobblestones here, but if you go to some places, they have cobblestone streets, things like that. Even just blips in the sidewalk, right? Sometimes the connection of the sidewalk is a little up. Footwear. That's a big one. Flip-flops, clogs, sliders. If you can slide into your shoe, you can slide out of it. So good, secure footwear is important. It needs to be around your heel. Good tied shoes. Now, people get the slip-ins because it's hard to reach down and get your shoes on, right? Or to tie your shoes. They've got ones with Velcro. They've got ones now, and this is nice. There's new technology all the time, and I love it. And I think it's mostly Skechers. They have the ones that you can slip into, but they've got a heel support on them. And that's the big thing, is you can get into it without having to lean over, but you're not going to slip out of it unless you purposely take it off. So look into that, too. Those are good options. A chair? To put them on. Yeah, right. Right. What about the ice? Yak tracks, yeah. I love my yak tracks. In fact, I just have my pair on my pair of boots that I wear out in the woods. However, there's a catch-22 about the yak tracks, and you're smiling because you know. They're fabulous outside on the ice. It makes me feel so much more confident. In fact, I get really scared when I don't have them on. If I'm just even walking in from my car for the parking lot, I'm like, oh my God. The problem being, once you get inside, if it's not carpet, they become 1,000 times worse. I mean, they're 1,000 times more slippery on tile. So if you're coming into the home, you really need to have a chair right by the door, and you need to sit down and take them off the minute you're inside. It's hard because you want to wear them out grocery shop to go to the pig to get in from the parking lot, but then the pig has that cement floor, and it's super, super slippery. Yeah. So there are better options now too, though. There are shoes that have the tread on the shoe is better for ice that aren't going to be slippery once you get onto a tile floor. They're kind of using the technology of broom ball. Does anyone know what broom ball is? Is that, the game that you play on the skating rink, but you're not on skates? Yeah, so they had to have shoes that had grips. And so they're kind of using that and making normal shoes for the rest of us. So curling. Yeah. So look into some of that for winter. But what if you don't have special shoes and you're on the ice? Yes, good. I'm glad that marketing is really kind of coming in. Walk like a penguin. What does that mean? That means, first of all, you want to spread your feet a little bit. The bigger base of support you've got, the more balance you're going to have. Penguins don't have a long stride like this, right? Penguins have but it's like, and they waddle. So the point being, you don't have to necessarily waddle like that, but the point being is you're going to slip when you're coming down like on your heel and you're going to go woo and you're going to do the splits. If you keep your foot flat and walk flat footed with your feet a little bit apart, you're going to have better balance on ice. You're not going to slip as much. It's when you have that stride here that you start slipping both ways and doing the splits. So flat footed and not in smaller strides. So you're like a penguin.
That works for going to the bathroom at night. Also,
Yes.
when you don't want to rush, you can run left and right.
Yes, exactly.
I mean, that's seriously.
Yeah, absolutely. Absolutely. Okay. So what can you do? We kind of talked about it already. What can you do to decrease all your extrinsic factors for risk of falling? Footwear, we talked about. Home environment, we talked about. Community environment. Crosswalks, uneven surfaces. We've got a lot of uneven sidewalks in the villages. Be careful. I mean, we only have sidewalks in the village, in the villages. Have you noticed that? Once you get outside of the village, we don't have sidewalks. And then we've got the pavement that you have like a lip about here, and then you've got the shoulder of a little gravel. So be careful of that, right? We don't have good walking when we're not in the village with sidewalks, but our sidewalks can be uneven. Tree roots, like I said, ice. Crosswalks. It is state law in Wisconsin that if you're in a crosswalk, if you're in the crosswalk, you have right of way to the cars. We all know that the tourists don't necessarily stay in the crosswalks, so it makes it very scary to drive through the villages because they're popping out in between the cars and everything. But with that said, be sure you're in the crosswalk, right? But also don't trust the cars, right? So just for safety's sake, I kind of stop and wait to see if they're going to slow down. I can make eye contact with them. Make sure they see you, you see them,
On that same thing, at now 8:00, 8:30, 49, on the dot.
Yeah.
Cars have their lights on, they see us quite well, but they're in the shadow. Poor cars.
Yep. Any other thoughts, comments about extrinsic kind of stuff?
I had a for walking on a paved area off the side of the white line, between the white line and the actual metal shoulder. I wasn't looking, I wasn't paying attention. I hit a divot even in the paved area, and ended up losing my balance and trying to save myself. The truck was coming this way, just
goodness.
feet of me.
Yeah.
And it still gives me jitters to think about that, but it was literally, I was assuming I was walking on flat. Don't assume you're walking just because it's a concrete or a paved surface. Don't assume that it's smooth.
Yeah. Yeah, exactly. Exactly, right?
Krista,
Yes.
I have one. I'm not sure if this would be considered extrinsic or intrinsic,
Mhm.
but when you were demonstrating how your mom felt,
Mhm.
when she turned away from the counter where she was, you did a pivot with your left foot.
Mhm.
And I find that pivoting is sometimes not a good idea.
Right.
It makes you really momentarily dizzy, and I find it better if I want to turn, which I do all the time because of the nature of my family teaching. It works better to plant one foot, and even though it takes a couple extra steps, rather than pivoting.
Well, yes. And you're bringing up the same point of walking on ice, right? We talked about flat-footed. If you're more flat-footed, you're going to have better balance on uneven surface or a wet surface or, yeah, exactly. Yeah, exactly. So, like I started with, the biggest take-home message of this section is really look how what we just talked about for over an hour. There's a lot of things that go into maintaining your balance, getting your balance, maintaining it, creating falls. There's a lot of stuff. It's very complex. So as you've talked, maybe you think there's going to be certain areas that are more important to you versus the next person. So what are the issues that you've kind of found in your, as we talked for the last hour, that you tagged of, oh yeah, that's me. Oh yeah, that affects me. Start there, right? Everyone has their individual issues. And so you just have to address your own issues. Start with one piece, and you can make a dent in the impact of fall risk. Add a little bit more, add a little bit more. But you do have control over all of these things, right? That's the biggest message I want to give you. You have control over it. You can make changes in these things and decrease your risk of fall and feel safer and more confident. And because this is so complex, this is my RISE class. This is my commercial, right? So RISE, Reducing Incidence of Falls with Strength and Education. I decided that because of certainly our patient and population demographic up here, this is a huge issue. I get asked to talk about it a lot. It is so complex. I said, okay, I'm going to make a class. It is 6 weeks. The next cohort starts August 31st. It's every Monday afternoon from 1 to 3 for 6 weeks, minus Labor Day. And we talk about all this, all the complexity of this. So I want to go back to this screen. So what this class does, like I said, we meet for 2 hours for 6 weeks. It is free. Just need to register for it because the space is limited. I personally have a classroom. We have a classroom in the clinic on the second floor if you've been at the clinic. So the space is limited and there is a little bit more interaction, so I can't fill up the room too much. But all you have to do is register. It's free. We do ask if you register, though, that you do commit to being there for the 6 weeks because other people would have wanted that seat if you can't do the whole 6 weeks. We will do it again if you can't do all those 6 weeks. We have been doing 1 to 2 a year, so there'll be another one. But I teach the physical therapy part of it, I go more into depth of how I started off talking about those 4 systems that hold your balance. I talk about the education, the exercise part of it. I do an entire hour on how to fall, mitigating your risk of injury, and how to get up. We'll talk about that here in a few minutes because I know people want me to talk about that a little bit, but just know that's a whole hour and a half lecture. So I'm just going to kind of skim the surface a little bit here. But if you come to my class, we'll go into it in depth. And the fun thing about that is you get to see me flopping around on the floor. It's a very popular class. But what I do is I do the PT part, and I develop the curriculum, but I bring in all these different speakers to talk more about their issues. Not necessarily a physician, but I have an occupational therapist that comes in and does an hour lecture. I have a podiatrist that comes in and does an hour lecture. I have a pharmacist that comes in and does an hour lecture. I have a dietitian who comes in. I also have community partners with the YMCA that comes in and talks about their resources they have, the ADRC, and what resources they have. I have captain from the EMS come in and talk about what happens when I call 911. What do I expect? What's going to happen? And they talk about the whole 911 system. I have a mental health professional come in and talk about the anxiety. It's anxiety ridden. If you've fallen, you get scared of falling again. And that whole thing that happens with the anxiety around falling. What else? Am I missing someone? But you can see how complex that is. So let me go back to my RISE. Whoop, too fast. So Christy Wozniacki, some of you might know her. She helps me facilitate the course. You can call her to register. You can also go to the website. I'm not 100% sure the website is going yet. This is Sister Bay Clinic. Sister Bay Clinic on the second floor. Okay. Our marketing department has to put that website up. I'm not sure they've done that quite yet, but you can certainly call Christy or give me your name and phone number before I leave today, and I'll get you on the list for Christy to call. Okay. But I highly recommend coming to the class, not only because you get to see me again, but we get much more in depth on all these topics.
I had a moment of humor when I fell one time.
Mm.
And that was, you know how you're always supposed to bend your knees,
Mhm.
you're told all the time, don't hurt the back, bend your knees. Well, it's hard to bend my knees. As I think that most people our age, it's hard to bend your knees.
Mhm.
So instead of bending my knees to pick up something off the floor, I do the whole standing up, reaching out to pick it up, only to find myself falling slowly over and landing on the top of my head. And it was so funny.
That's very common, actually.
I laugh.
Yeah. Well, it's good to laugh at ourselves, right? Better than crying sometimes, but it's good to have some humor in it.
You landed on the funny bone.
There you go. Any questions about the RISE class? Any comments, thoughts about what we've gone over so far before I change the topic? Yeah.
It's fun and it's totally worth it.
And Gail has been, yes, she can attest that it is, hopefully, that it's a good class. I don't, unfortunately. We're just in the process of really getting all the media and marketing together, so I don't have a flyer to give today, unfortunately. Yes, I will do that. I'll email you one when we get one. Well, you know, it's going to be here before it's going to be here. Y'all get out of your way, so me in the picture. It's going to come fast, August 31st, but I really enjoy doing it. It's a good class. And I learn something new every time from all the other professionals that we bring in. So, all right. Let's talk about being on the floor. It happens fast. So all of a sudden you're on the floor, and let's talk about the floor. We know we defined fall being you could fall back on the bed, you could fall back into the chair, whatever, but usually you can get up from there. So you're on the floor. What's the first thing? The first thing you need to do is just take a deep breath. Just say all the cuss words you want to say out loud or in your head. Just take a moment, okay? The 5-second rule does not apply. Y'all know the 5-second rule. Oh, I said no. 5-second rule is if I drop my cookie and I get it up off the floor within 5 seconds, I can still eat it. That is the universal 5-second rule. It does not apply to human beings. If you fall and get up within 5 seconds, you still fell, right? It doesn't mean that you wiped out the history of your fall, okay? So just chill out for a minute. Now, because what's important is the next part. You need to kind of ask yourself, am I injured? Do a scan, head to toe. Am I in pain? Where am I in pain? What am I feeling right now? Am I bleeding? Take a minute, do that scan. And it goes back to this. If you're in public or you're at home with a spouse, people are so kind. They want to help, and they want to help very quickly. And you fall, and they're there, and they're yanking on you. I'm going to help you get up. And they're trying to yank on you to get up. Sometimes you need to tell them, give me a minute. Because if you're injured, they can do more harm to you and themselves. Okay, so first you just need to assess, are you injured? Am I bleeding? Do I hurt anywhere? Then start moving things. Okay, you might be laying down, move your neck. Does that hurt? Move your shoulders, move your arms, move your legs. Move everything. See if anything hurts when you move. Okay, because it might not show you it's injured until you move it. Let's say I did all that. It's like, no, I'm okay. I'm not bleeding. I don't have any pain. I'm not injured. I think I can get up. Okay. Then you can start getting up, either by yourself or with help or call. Okay. But really do go through these steps. And I know it's embarrassing, right? And especially if people witnessed it and they're wanting to help, and so you want to get up too really fast. Please just chill out for a minute, take a breath, and find out if you're injured first. Right? If you're on blood thinners, which a lot of us are, Eliquis or Farron, if you're on anything that thins your blood, and if you've hit your head, you really need to go to the hospital. Even if you feel, oh, I'm fine. That's something that you're not going to feel for a while, and that absolutely can be fatal. So you do need to go to the hospital and get checked out if you hit your head, if you're on blood thinners. Okay? Yeah. Well, it kind of depends on for what and for how long and what dosage. So, as you, yeah, that typical low dose kind of preventative for heart and colon. I want to say not necessarily, but you need to judge. Each person kind of reacts to that more. So if you like bruise super easy, if someone blows wind on you and you bruise, then your blood's pretty thin. I would still go. Yeah. And certainly, even if you decide that you're not injured and you get up and later on you say, oh, I just kind of have a headache, you need to go get checked out. Get confused, anything, vision changes, things like that. All right. So how do you get up? I'm going to teach you how to do it this way. The thing about getting up, is that there's no one way to do it. And if you guys know me well, I love options. I talk about options about everything. I love options. There's no one way to do a lot of things, and there's no one way to get up off the floor. You don't have to be told how to do it. You know how to get up off the floor. We've done it for decades of our life. We don't tell a toddler how to get up off the floor. We're hardwired neurologically. The problem is we lose the ability. And it kind of goes back to that strength issue. If we don't use this body, we lose the ability to use it. If you haven't been on the floor in 5 years, you might lose that ability to do that. Going back to training for your life. If getting up off the floor is something that's very important to you personally, and I don't see it might not be. You might be like, oh, it's all right, I'll have someone help me get up. But if it's important for you as an individual to maintain that ability to get off the floor, then you need to train to do it and practice it and keep doing it. Because the reality is, if you haven't done it in 5, 10 years, and that one time you fall, you probably will not be able to get up because you're lifting your body weight from the ground, right? If you're having difficulty getting out of a chair and lifting your body weight from a chair, think about lifting your body weight from the ground, right? That sounds very sad. I mean, I didn't mean to have my stern voice again, but you can, but also here's the thing, you can relearn that. You can gain that strength back. That's what I'm saying. That's where you can get stronger no matter what age you are. Now, to be safe about that, I would come see a physical therapist and have the physical therapist work with you on that, because it's not like I'm going to just say, okay, get off on the floor, get down on the floor, and we're going to do this. There are segments and things to work on and things that we can work up to actually getting back that skill back for you again. If you have been on the floor in the last week, yay, practice it. Keep doing it. Keep practicing that skill. If it's been a long time since you've been on the floor and you really want to regain that skill, come see a physical therapist. We can certainly help you do that. Okay. Well, if you know that you can't do it, like I say, if you've been on the floor in the last week and you know that you can do it, yes. But if you have any doubt in your mind that you can't do it, then make sure you have, Yeah, don't do something you're not sure of that you can do or not. So we all have our own different body issues. Someone might have a bum knee, someone might have a bum hip, and that changes how you get up off the floor. But like I said, there's no rules of how to do it. It's just getting the task done. And what I hear a lot of is, Krista, I can't get up off of the floor anymore without pulling on my arms. Okay. You can still do it though, right? I mean, that's absolutely not a bad thing. You can use your arms to get up. That's fine. So options are good. And don't worry about pulling up. And most of the time, at some point, we do need something to pull up on. So with that said, some things that you can practice doing is practicing the parts of things. Not necessarily the whole thing, like, I don't want you to go home and say, Krista said I should get down on the floor and get back up again. If you haven't done that in a while, please don't do that. Don't misunderstand me. But we can practice parts of it together in progression therapy. Most of us do need something to pull up on. So if you're on the floor, you've got to get from one place to another. If I'm here, I need to come over to that chair to help pull up. There's different ways of doing that. The most classic way is crawling. Don't get on the floor and practice crawling if you haven't crawled, but you can maybe get on your bed, right? If you're on your bed, you can roll over and see, just even practice on your bed where it's nice and big and soft and comfy, and you're safe. See if you can get up on your hands and knees and take a little crawl step forward and back. See if that's still an option for you. Again, if you are worried about your ability to do that, don't do it alone. Come see a physical therapist. But you can practice that crawling on a safe area with your bed. A lot of us can't get on our hands and knees anymore because of wrists, because of knees. So the other thing you can do is the boot scoot. You know what I'm talking about, boot scoot? Oh, let me get on the floor. All right, so you're here, boot scooting. Okay? Again, you can practice that on your bed. Okay? What if you can't sit up like this? Right? You don't have that. You're here. Well, I can side swim. Right? And I can do it with two hands here, right? So you can practice on your bed getting from one point to another, because then I can come over to the chair to get up. Okay? But a simple thing that you can do at home is just practice those in your safe environment on the bed. Okay. These are a little bit more advanced, but the most classic thing I'm going to have to put this down. So if I'm crawling over to the chair, the most classic thing is to get up on a knee and pull up, feet up here. And it's always going to be safer. It's always going to be safer to go from the floor to a chair than thinking of going to the floor all the way to standing up. Because then I can just pull up to the chair and sit in the chair, and then I can stand up from the chair, right? But instead of going right from all the way down here, maybe you just practice here. Okay. Making little bits, parts of it, so you get that strength, and then working. That's exactly what I did. Forearms on the chair, stepping back. If this is readily available to you, I want to stress, you need to stay safe. I'm not saying go home and do this if you haven't done it in years. Come see a physical therapist and we can help you regain this skill if this is still not available to you, okay?
So with her encouragement to come see a physical therapist, I or trans people I spoke to, their little tagline is no for the community. So go work
I
on
like that.
getting up off the floor, so, or getting the strength training, so maybe you won't need.
Exactly, exactly. I don't know if I have another screen on here or not. Questions? Thoughts? No, that's a real brief. Now, I have a whole hour-and-a-half lecture on that. I talk about how to fall more safely, how to get up. I do lots of demonstrations of exercise. Like I said, I'm flopping around on the mat. It's very popular. But questions, thoughts? Yeah.
Thought, maybe in a question, I don't know, but I think pets can be a problem, especially if you have a cat or
Yeah.
a small dog, and they're walking along and you don't see them.
Exactly.
That kind of happened when it's falling.
Hmm. And so many dogs in particular like to jump up and say hi, right? So they're jumping on you. Right? Yeah. I've treated many patients that were pulled on the walk and either had shoulder injuries or a fall because the dog pulled. Saw a squirrel it wanted to chase. So yeah, there's always those type of things. And someone brought up having a cell phone for safety. Any of those situations, right? If you're out walking the dog, you're out on uneven surfaces. Even if you're home alone and your spouse is gone, make sure you got your cell phone on you. So if you fall, you can call for help. Yes, exactly. They have nice, yeah, she has a nice strap that she wears it around. The other thing, and the other person I have that comes and talks at the RISE class is the medical alert system. It's called, I just scared it out of my brain. Medical assist button. The woman, the representative is from Door County Medical Center. For the medical alert button, you can wear around your neck or wear on your wrist. And they're by cell system now, which is great because you can be anywhere as long as you have a cell signal. You don't even need your cell phone. If you fall, you can just push the button. And what they do is you have a person that they'll call to help you. So it doesn't go right to 911. So if you have a family member, they'll call them first, or a friend, family, neighbor, whoever. They'll call that person first if that person can come over and help you. If they're not available, they kind of have 3 lists, and then eventually they'll call 911 if they can't find someone that can come help you. Or if you don't answer. If you push the button and you don't answer them, and it's by speaker. So it's kind of like Spock. They answer you like, "Hello, are you okay?" But if you don't answer them, they're going to call 911. And this is the nice thing about when I have the captain come talk to us, because people get all upset, like, "Oh, no, don't call 911. I don't want to bother them." They exist for us. So yes, we should use them when we need them. Don't be like, if let's say it got hit by accident and you didn't answer and 911 showed up, the captain's going to reassure you that that's okay. We're here for you. We would rather come to your home and find out that you're safe and sound than to not get called by accident. They want to reassure us they are there for us. Yeah.
My Apple Watch has fall detection.
Yes.
And I have fallen, and I had to very quickly tell it that, yes, I had fallen. But I was okay.
Mm-hmm.
Had I not responded, or had I said, I'm not okay, it would have called 911 for me.
Yes. Yeah.
Immediate. Yes, it was immediate.
It's very reassuring, isn't it? Yeah. Yeah, it's very reassuring. The technology we have these days, just crazy. Yeah, I didn't fall, but I was in a car accident. And it detected my car accident. Yeah. Yeah. And I didn't answer it because I was so busy with other stuff. And all of a sudden I heard this ringing. I'm like, what's ringing? Oh, they're dialing 911. But the ambulance was right there in front of me. I was like, they're calling you. They're calling you to come pick me up. Other thoughts?
It's also helpful, and I'm very fortunate to have a daughter close by. And she's constantly reminding me, you have your phone on you, blah, 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 to the point of almost nagging.
Well, that's what a daughter's job is.
So I am grateful for that.
Yes. Yes. All right. Did everyone think about one thing that they might be able to adjust to increase their safety?
I found that my places where I'm aware that I can put myself in a false situation have changed over time.
Mhm.
For example, I just recently discovered that it's when I pivot quickly. saying that.
Yeah, Gail said that too.
Just be careful because that was never allowed before. And now all of a sudden it's like, okay, everything's not coming around at the right time, and I need to be more aware of
Right.
activity. So I think that you, as your body changes, your areas of concern change.
Absolutely. Yeah, and it can ebb and flow. Certainly your areas of concern are going to be very different post-op for any reason. Even right after cataract surgery, right? It's changed your eyes, and you're putting a million drops in all day long. It could be very different. Even people, even shoulder surgery. People don't realize that if you have shoulder surgery, you've got owie and you've got a sling, that changes your balance because you've lost your arms that are helping your balance. So even shoulder surgery can be very effective.
I even found, somebody gave me 2 walking sticks, like,
Mhm.
I don't know what they're called.
Hiking sticks, yeah.
And I can't believe how helpful they are, because when I'm walking with those sticks, my posture improves like everything.
Yeah.
As I was walking,
Mhm.
and it's just easy to walk.
And we also talk at the RISE class. I'm going to keep giving a commercial for my RISE class. We talk about hiking sticks, how to fit them, how to use them, canes, walkers, all that kind of good stuff too. True. How many people will see people walking like this, right? I know. They are not. And here I am with my mother. I'm a physical therapist in the community, and my mom's walking down the road like this. I said, Mom, please, they know I'm a PT. I said, walk up straight. I know. And sometimes there are reasons why they can't stand up straight, or so you have to kind of give the benefit of the doubt. Yeah. Right. All right, guys. Thank you so much for having me. Appreciate it. Listen, if someone has a piece of paper, and if you want to write down your name and number to get on the RISE class list, I'll have Christy call you if you want to give me your name and number before you leave.